Hi all, I'm Dr. Malati, working as a professor in Trippuram College of Nursing. In this video, I'm going to discuss about the methods of placental separation. The objectives are introduction, definition, mechanism of separation, methods of placental separation, science of placental separation, management of third stage of labor, nursing management, complications, summary and conclusion. Introduction. Third stage of labor commences with delivery of the fetus to delivery of placenta and its attached membranes. The duration of this third stage of labor will be between 5 to 15 minutes. So here during the third stage of labor, the placental separation occurs. After the birth of the fetus, it happens due to the uterine contractions and retractions. Definition. The third stage of labor begins immediately after the delivery of the fetus and ends with the delivery of the placenta and membrane. So as I told you earlier, the duration falls between 5 to 15 minutes and rarely it will exceed 30 minutes. So the goal, if you see, safely expel the placenta while minimizing the blood loss to prevent PPH. This is an image of placental separation. One is Schultz method, another one is Duncan's-Matthew method. The mechanism of separations, mainly it focused on three aspects, that is uterine contraction and retraction, elasticity and separation plane. So uterine contraction and retraction, after the fetus is born, the uterus contracts strongly and also it reduces the surface area for the placental site. Then under the elasticity, the placenta becomes inelastic and cannot shrink, causing it to buckle and detach from the uterine wall. Third aspect is separation plan. Separation usually occurs in the spongy layer of the decidua basalis. Methods of placental separation. As I told you, there are two methods of placental separation. One is Schultz method, another one is Matthew Duncan's method. Schultz method is a central separation and Matthew Duncan's method is a marginal separation. Schultz method, most commonly 80% of cases will separate the placenta by Schultz method. The mechanism here it happens is the separation usually begins at the center and the center separation may lead to a retroplacental hematoma. A huge hematoma will form behind the placenta, pushing the center out first. So presentation, if you see the fetal surface, that is the shiny surface, which is nothing but the amnion part will present first, and here the blood loss will be minimal. The remaining blood will be form as a retroplacental hematoma behind the placenta. Next is Matthew Duncan method. It is less common method and here the separation usually takes at the margin level. The maternal surface, that is the rough red shaggy appearance will be present. Here there is a space for the blood to escape immediately. So here there will not be any retroplacental hematoma. Here the bleeding will be visible and also continuous. The signs of placental separation. So as a nurses, during the third stage of labor, we should know the signs of placental separation. So before that, watch for the signs of placental separation. Before that, we are not supposed to pull the umbilical cord. So the signs are uterus becomes firm and globular, fundus rises up to the level of umbilicus or above, lengthening of the umbilical cord, sudden gushing of blood will be there. Management of third stage of labor, active management includes administration of prophylactic oxytocin, which is nothing but 10 units IM, then CCT control contraction, fundal massage after the placental delivery. Expectant management is waiting for the natural signs of separation and maternal effort. Nursing management, first and foremost is assessment, monitor the vital signs, fundal height and vaginal bleeding, and also Watch for the signs of placental separation. Intervention, administer the oxytocic agents as ordered by the obstetrician. Examination, immediately after the placental separation, watch or inspect the placenta for any missing cotyledons. Ensure the completeness to prevent the PPH and infection. Then documentation, time of delivery, method of delivery and condition of the placenta. Complications, there is a chances of retained placenta, and if the placenta not delivered within 30 minutes, then PPH due to uterine atonicity and also due to retained placenta, then inversion of uterus. Summary, placental separation occurs in the third stage of labor due to uterine contraction and retraction. It mainly occurs by two methods, Schultz method where separation begins at the center and the fetal surface appears first, and next method is Duncan-Matthew method where separation starts at the margin and the placental surface appears first with visible bleeding. Conclusion, proper understanding of the methods of placental separation helps nurses and midwives to identify normal progress and to detect the complications early, especially PPH, ensuring the safe maternal care. References. Thank you.